So, good morning. Welcome to the World Health Summit 2024. Again, this is the third time the WHO Health Emergencies Program, represented by the Hub for Pandemic and Epidemic Intelligence here in Berlin, is having one of the first sessions in the summit. And really, it's an important opportunity for us, together with the Federal Republic of Germany, the organizers of the summit, to set the agenda on a few important issues for all of us. And nothing could be more important today than trust, which is the theme of this World Health Summit. 20 years ago, when we had a bipolar world, we could understand a little bit where trust was deficient and where we needed to build it and the challenges in between. But today, we live in a multipolar world with many more dimensions to the challenges and opportunities that we face. We face the evolution of strong sovereign countries that obviously have their priorities, and rightly so. We face an opportunity of the emergence of strong regional blocs with regional interests that need protection, and we have to think about that. It's a legitimate concern. At the same time, we live in this global space, and there are things we can neither solve in country blocks or in regional blocks, whether it's antimicrobial resistance or climate change or the emergence of new threats. These are just simply not problems, no matter how wealthy we are, how strong our military is, how strong our academia is, that we can solve in small groups. We have to think together as a world, and that's where trust comes in. So trust is both something we need to work towards an objective, but it's also an objective on its own that comes out of the work we do together. So today we'll see and hear and listen to many voices that will share different perspectives on this important topic. And I hope that at the end of this, we'll all come out a bit more enlightened, but also a little bit more humble with the challenges ahead of us. So that's all I'll say for now. But to get us started, I'd like to introduce someone that probably needs no introduction. He's led a lot of the work the emergency program in WHO has done for many years. But in the 3 years I've worked with him very closely, I've learned that nobody cares more about the work we do, about the emergence of new threats, the response to existing ones, whether they're infectious disease threats or humanitarian threats, or just the consequence of the many conflicts that we see around the world today. So please, gentlemen, ladies and gentlemen, help me in welcoming Dr. Mike Ryan to the stage.
Okay, good. Good morning, everyone. This is quite a show for a Sunday morning, so which is great to see a topic like this attracting the attention it should. And I see many people in the audience who've been championing these concepts for many years against huge obstacles. I see Sarah from our program. Sarah, welcome. I see Sylvie Brion, who's now at the Global Preparedness Monitoring Board, who's been a champion of this issue for many years. The Cambridge Dictionary doesn't really define trust. It defines to trust. It's very different. Trust is not a commodity per se. It's an active process of trusting. Sarah's educated me on that in terms of being worthy of trust, being trustworthy. To believe that someone is good and honest and will not harm you, or that something is safe and reliable. Good and honest, will not harm you, safe and reliable. So what does it mean to be worthy of trust? To be trusted, first of all, you need to listen, and that's something we forget all the time. Trust is built over time, and today specifically, it's built on concepts that are more about locality and diversity and context than they are about spun messages at a global level. Trust is a decision. We decide to trust someone else or something based on a number of factors. Often that decision is based on how alike or similar the person is who's asking me to trust. Whether I feel you're capable. Are you credible? Do you have integrity? Are you predictable? Will you change your mind in 2 days' time and tell me to do something totally different? Do I feel our interests are aligned? Do I believe your concern for me is real? Will you take a risk to protect me and protect our trust? Do I have sanction over you if you breach my trust? And that's a very important issue. People think that because you have power over someone, they'll trust you more. That's exactly the opposite. The more power you have over someone, the less they will trust you. The question is, are you prepared to cede power in order to gain trust? To communicate in a way that imparts your own fragility or your own lack of power in order to gain the trust of another. Barack Obama said, if the people cannot trust their government to do the job for which it exists, to protect them and promote their common welfare, all else is lost. And that comes to the concept of political trust. And then there's institutional trust and social trust. But today we're, to an extent, talking about trust in governments and institutions. But in order for that trust to come, we often talk about gaining the community's trust, the community trusting us. But what about us trusting our communities? And that's often not the case. I saw that happen in COVID. The lack of trust in youth caused a tremendous negative response from our youth. We didn't trust them. They were breaching COVID regulations. They were doing this. There were negative stories all the time because we didn't trust them. So the question for me is, how do we make our communities feel trusted by us? Because you need to be trusted by those you're asking to trust, and you need to trust those that you're asking to trust you. This is, as I said, especially true of youth. Chinese philosopher Lao Tzu, and I've probably pronounced that very wrongly for our Chinese colleagues, but it says, he who does not trust enough will not be trusted. And I think that's something we need to think about. And I say that particularly in relation to the institutional trust that we're talking about today. Because we're talking about, as well, not just how we build trust with communities, but how do we, as Chikwe said, engender trust between entities and institutions who have to work together. But they often work together where they have not necessarily exactly the same interests. For example, there's an awful lot at stake globally in terms of reputation, visibility, influence, funding. So how do you build trust in a community where we're competing for the same dollar, competing for the same visibility, and competing for the attention of the people who support us? And the only way we do that is, again, as Chikwe said, focus on the people we actually serve, not ourselves, but focus on the communities that we're supposed to serve. And that's one of the bigger challenges I think we're facing right now. We're in a situation where we've never had as much science, never had as many institutions with capability and integrity and the ability to work with communities, but we're often at cross purposes. We're often cancelling each other out through competition. And we need to find a way to get through that and beyond that. So we need that trust between institutions to deliver on our common goals in the service of our only true clients, the people. At societal level, you've all, and we'll probably go on and on about this, we're seeing historically low levels of trust in government and scientific institutions. In a world where education is more readily available than ever, where information is at everyone's fingertips, why have we seen such a loss of trust in institutions by society and between people in our communities? I leave that question to people who are much better qualified than me to answer it, but the reality is, for us, that is the reality. But the failure for me does not lie with the communities or society. The failure lies with governments and institutions. Yes, there are negative forces driving mis and disinformation, and that's true, and we tend to deflect the blame onto them, but they're only exploiting a distrust that has been emerging over decades in government and in institutions. Gone are the days when our communities will blindly follow the wisdom of government and their associated institutions. People are rightly questioning more. They want to be consulted on decisions that affect their lives, and they're unwilling to trust governments and institutions that are not worthy of their trust. Quite simply. And we as a community have to address that. And the challenge we have in specific relation to health emergencies, and it's a very narrow place, is understanding, measuring, monitoring trust. What does it mean, trust and trustworthiness? How do we build and protect that before and during pandemics? And how are we going to navigate the next pandemic in what will most certainly be a low trust setting? So there's two things. We can build trust, but we're not, honestly, if we're being really honest in the modern world, the next pandemic will be conducted in a low trust setting. How are we going to do that? We've had many initiatives around that, and we're launched an initiative on trust and pandemic preparedness to monitor, measure, protect and strengthen trust for health emergencies. But there's much more that needs to be done. And our science division and others are working on broader initiatives like networks of healthcare influencers, the evidence-informed policy network, really looking at citizen engagement on a much broader level. So we have to focus on health emergencies, but we need a much broader set of activities that go well beyond my program and Chikway's program and well beyond our own specific health emergency preparedness program. So with that, the discussion this afternoon or this morning is very important because it speaks to the heart of what we're going to have to do, and that is to prepare and potentially respond to the next pandemic in conditions of low trust. How are we going to do that in the service of our people? Thank you. Sorry. And I now have an honor I've never had before. And that is the honor to introduce Minister Karl Lauterbach, who's going to come and speak for a few minutes as well. And I just want to personally recognize the incredible influence that Karl and his team have had on global health security, the investments that have been made, the leadership during the G7 and rapid response teams. Karl is a walking, talking advertisement for science and why we should trust in science. And someone who I have huge personal admiration for, huge gratitude for your leadership, Karl, and no better environment for you to be talking than in an environment that talks about trust in science and trust in public health. Thank you.
Dear esteemed colleagues, participants, ladies and gentlemen, we are living in a very dangerous world, as a matter of fact, and that is no exaggeration by any means. Therefore, building trust for better decision-making in public health emergencies has never been more important. Currently, we have about 50 armed conflicts and wars, and there, it seems to be the case, is more to come. Nuclear war, for the first time in a generation, is no longer an abstract threat, but is actually discussed as a reality, as a potential reality, for the first time in decades. The planet is in the worst health shape than it has ever been before. We are approaching tipping points, and tipping points, some of the tipping points are only a couple of decades away, no longer centuries. So the speed at which the planet is becoming ever more unhealthy, putting everything on the planet at risk, is actually, it is unbelievable. And all of the scientific assessments where we are with respect to some tipping points had to be corrected in the last couple of years, and always in one direction, that we underestimated the threat, as a matter of fact. So there was a systematic bias, apparently, for underestimating the threats of the planet. And there is more pandemics to come. That is quite certain, because with the shape of the planet and with more people living and with more zoonotic diseases, it is quite clear that we will see more pandemics. We have about 10,000 viruses that are potentially viruses that could cause pandemics. And additionally, we will become ever more capable to introduce artificial viruses into our global sphere. We also now have to reckon with the threat of AI. I'm myself using AI all the time, and I'm very keen to introduce it into our healthcare system. But honesty has it that we also have to be aware that AI coming so quickly, as no technology of that importance has ever come forward so quickly, that it poses a threat that we currently are not fully able to assess and master, as a matter of fact. So to put it in the words of Johan Rockström, whom we yesterday rewarded with the Virchow Prize, we are living in a huge world on a small planet. And I would like to add, we live in a huge world on a small planet, which we are about to destroy. So therefore, meetings like ours are very important occasions where we have to reconsider where we currently are. When we want to meet these risks, these major threats to mankind, there is but one vaccine that we can use for basically addressing all of them. And the vaccine does have to go into policy making. It has to go into politics. The only vaccine that will help here is science. Our best vaccine in addressing all these issues is making science the basis of all our policy making. So therefore, putting science into politics and policy making is as important as putting a vaccine into a child, which otherwise it's not likely to live for a long time. Science is at the heart of effective policy making. It does not substitute for the wisdom in policy making and for the ethics in policy making, but with the best wisdom and the best ethics, you will not be successful if the work is not rooted in scientific evidence. Without science, we will not be able to master rapid responses to the threats to come. And here I can only remind you of the very important early words that Mike Ryan found so extremely eloquently, that we have to hit hard and we have to hit early. And for all of the threats that we are to discuss at this venue, at this meeting, one thing is clear: we will only be able to master the challenges if we are well prepared and can hit early and we can hit hard. What is at risk here is nowadays not only the health of the planet, but democracy as a way of governing countries. As a matter of fact, populism is the worst enemy of science. Populism always starts in creating distrust and starts basically by attacking science. We see this all the time, and every crisis, as a matter of fact, is a gift for populism. So what we want to prevent and avoid and master is a gift for everyone who is a populist who wants to gain power and does not care about the health of the population. So therefore, democracy itself will become ever more jeopardized if we have crises which we are not able to manage. And indeed, what damages trust in democracy most is if it is not able to deal with a crisis when the crisis is at hand. So therefore, for us being able to master a major crisis is also our best way to defend our best way of living, which is democracy. We have many organizations that create scientific expertise, but this is only workable in politics and policy if we do have regional public health institutions which translate this scientific knowledge into policy-making advice. And this is why such a meeting is important, because the people who sit here are the regional policymakers who manage to put science into policymakers. So you are more or less, if you want, you are the doctors, as a matter of fact, for us politicians in vaccinating us with the scientific policy making. And I see Hans Kluge here. He is a pioneer for this. This is what he is doing all the time, as a matter of fact. A regional policymaker who is accepted, who is trusted, and brings scientific evidence into what we are doing. I would like to thank you on that occasion for the wonderful work that you are doing, for example, in mastering the public health challenges that we face in the Ukraine. Without you, we would not be able to master this catastrophe in the way we do. Thank you, Hans. Also, if we want to have trust, we have to speak with one voice. And indeed, it has to be the same voice that we use on different occasions. So what will not work is that we are nice and aligned in one room, but speak differently in a different room. And I say this because I observe this as a politician all the time. It is an extremely prevalent disease in politics, I can assure you. But for us, as the brokers of scientific knowledge, we need to speak with one language. Therefore, it is very important that we are also specific about some of the challenges that are ahead of us. And I want to be very open about what I think about these challenges where we have to make progress and where we have made some progress. Number one is to start with a success story. I really think that the agreement in May on the international health regulations, that was a major success. That was a major success because it is a first step towards a more binding agreement, and it takes care of the question, are we better prepared or not? It is not the only steps that we need, but it was a very important step. If we had not agreed on the international health regulations at the WHO assembly, that would have been a middle catastrophe. So I thank you for everyone who participated in rescuing the international health regulations. They were very close to failure. Number two is we need to be very clear and open about the pandemic agreement. I think it is quite unlikely that we will finalize the pandemic agreement by the end of the year, to be quite open about this. But it is possible that we will be able to agree by May, and that would be an enormous step forward. Years after the pandemic, if we do not agree on the pandemic agreement in the next couple of months, I think the discussion about the pandemic agreement, to be quite open about it, will become horrible. It becomes worse, because then we will start to move in circles, and the very process of discussing the pandemic agreement will be an opportunity of losing trust. So I think that we should all, at this occasion, quite openly speak about what is currently at risk and how we can move forward. And I think we need to be quite open about the three measures that we have to agree upon. We need better prevention, and better prevention also means that we, the richer nations, support the One Health approach in poorer nations. Because without a functioning healthcare system, prevention will not work in poor surroundings. So therefore, that is prevention, but also our obligation to invest into a One Health situation. Number two, we need also preparedness, and preparedness means in case of emergency, the poorer countries need to be clear that they get vaccines, measures, support by the richer countries, and immediately, at the same time in which the richer countries do get that support. So we have to be open and honest about it. In case of emergency, it will not be the case that the North will be vaccinated first and then the South, or if ever, but we have to be clear that we basically distribute our resources equitably so everyone gets immediately what is needed. But number three is equally important, that we will only have technology, vaccine, treatments if we support science. And if we erode the trust in science, and if we erode the trust in the scientific process, creating such vaccines, creating technology, then we will all not be prepared. So therefore, it is important to be open about the position of the North. If we want to distribute scientific results and scientifically developed drugs and vaccines, we must first have them. If we don't have them, there is nothing to be distributed. So therefore, we need to be open. The North needs an environment where scientific results can come across. The South needs a clear word that in case of emergency, the results of that work are equitably distributed, and we prepare in terms of better prevention, in also supporting the poorer healthcare systems. I think that this could be basically the rough draft of the pandemic agreement on which we are working together. Germany is fully committed to this pandemic agreement, and we will do whatever we can in order to make it come about at the very latest by May. Number 3, we also need funds that support regions and countries in being better prepared, because very often money is lacking. And I think that the pandemic fund is a very good opportunity. I do not remember a single major World Bank organized system which so quickly came up and started running. And the first investment rounds have really shown how much thinking and collaboration comes about in preparing for these funding rounds. So I think that it is a very valuable system, and it is also already showing that it can also rapidly respond in being now fundamental and also helping the mpox catastrophe. So I think that this is a good way. It would be unethical if we now have funds in the pandemic fund but spend nothing for mpox. Basically, this is not what the fund was developed for, but we should use the fund to support mpox response, but also not lose out of sight what the fund is actually built for, so that we come up with regional projects where we are better prepared for the future. I'm looking forward to the next pledging event, 31st of October, and I can already announce that Germany reinforces its commitment with another 50 million, and I hope that other governments and regions will follow here. And number 4, clearly we need better funding for WHO. WHO is showing its importance, its strengths on a daily basis. For example, the polio vaccination for the children of Gaza, a horrible situation, but WHO is on the ground and is helping children's catastrophe not to evolve even more. This is just one example. I could name many others. I've already mentioned the work of Hans Kluge in the Ukraine. So WHO needs better and more plannable funding. And I think that the investment round that we will have tomorrow is a very important opportunity, and I'm very pleased that we do this together with France and Norway as a regional investment broker. And I hope we will come up with a major amount. Germany clearly will commit to additional money, and I think that WHO is doing a wonderful job and deserves a clear budget which can be used in order to plan ahead of a time. WHO is too important to be begging for money on a yearly basis, but should get a real support more than we pledged before, and also on a plannable basis. So that is what Germany is clearly committed to, and we will do whatever we can in order to support EU investments here and talk to others who are making such investments. Finally, I want to come back to trust again, and want to share an insight which I think is, let's say, a good news regarding trust. First, trust, as a matter of fact, the bad news of trust is that it is built in decades and can be lost in an instant. And typically, trust is lost in the moment of crisis. That is the bad news. But the good news is, trust is like solar energy. It is without any limits. And trust does have a fountain. Like the fountain of solar energy is the sun, trust is basically coming from people. So people are the resources, people are the fountains of trust. And many of the fountains of trust are sitting in this room, as a matter of fact. So let us work together in order to collect as much of the unlimited resource trust as we can in these coming days. I'm looking forward to the discussions, I'm looking forward to the meetings, and I will talk to as many as possible. Thank you for your attention, and thank you for your wonderful work. Without you, it would definitely be not only a poorer world, but also a world without hope, as a matter of fact. So the hope is sitting in this room. Thank you.
Thank you, Professor Lauterbach, for your very open and incredible insights on the issues we are dealing with as a world, the very dangerous threats that we are faced with, and an interesting analogy about science as the vaccine to be able to address these threats, and how you have linked that to trust, focusing on us as an interconnected world, but also remembering to be people-focused. So thank you very much. A very good morning to everybody. I am Fiona Bracker. I am with the WHO Regional Office for Africa, and really pleased to be part of this important discussion that we will have today on a topic that is so central and foundational to the work we do, not only in emergencies, but in public health overall. And as the emergency response manager at the regional office, what we will be discussing resonates very much with the work that we do to protect communities, to work with countries, and to bring regional partners together to build trust in the interventions that we promote to save lives. So I look forward to this conversation, which we will be diving into with a great panel of speakers that have been lined up today. Before we get started with the panel session, I invite you to take a look at a video, a short video that we have prepared from the African region, highlighting how trust is integrated into our daily work. Trust is context specific, and at the WHO regional office, we work closely with countries to build this trust by being present, by delivering rapid response to emergencies, and also fostering strong partnerships at the regional, national, and community levels. I hope this video sets the stage for all of us to start to think about how we build trust. What does trust mean? And how can we foster trust in our own unique context? We will transition to a panel session that includes distinguished representatives from different regions to share their own perspectives about building trust in their unique context. Together, we are going to try and unpack the topic of trust from a regional perspective. We want to explore the challenges and the opportunities and concrete pathways that could be put forward for building trust in emergencies. So please join me in welcoming our panelists on the stage. Joining us, we will have Dr. Hans Klug, the WHO Regional Director for Europe. We have Dr. Pamela Randy Wagner, the Director of the European Centers for Disease Prevention and Control. We have Dr. Hanan Balki, the WHO Regional Director for the Eastern Mediterranean region. She's joining us virtually, and she can hear and see all of you. We have Dr. Raji Tajuddin, the Deputy Director General for the Africa Center for Disease Control. And we have Dr. Lisa Indha, the Interim Executive Director of the Caribbean Public Health Agency. Thank you very much, our panelists, for joining us. It's quite a unique opportunity to have a diverse group of regional public health leadership in one panel. And we want to begin to explore the concept of a regional effort to build trust and discuss how you've been building trust at the regional level to enhance emergency preparedness and response. We'll start off with Dr. Hans Klug, the WHO Regional Director for Europe. He is a leader dedicated to advancing health systems and emergency preparedness across the European region, as we had. He has led WHO's response to health emergencies across 53 countries in Europe and the Central Asia. Dr. Klug, as has been mentioned, trust is critical for collaboration in emergencies, but trust is not something that is prescribed. It's rather something that is built and it has to be earned. Can you share with us how WHO in Europe is concretely building trust in your region?
Thank you, Fiona, and first and foremost to everyone, welcome to my region. And thank you very much, Minister Lauterbach, for your very strong support to WHO. And we started this morning with a breakfast at the WHO Berlin hub, where I was when it started, and I'm amazed about the very quick development and the strength under Chikway's and Mike's leadership, so thank you for this amazing support. So going back to trust, we recognized this early on in the emergencies, how important it is, and actually, in December last year, we convened the European Health Leadership in Tallinn, Estonia, for the Health System Conference around the theme of trust and transformation, the two keywords that we believe are essential to build a resilient health system, be it in peacetime or in wartime. Actually, as the minister was telling, we live in a perma-crisis, so the health system at the same time have to deliver universal health coverage and manage crisis. And we identified there are many groups, but we focused on 3 groups for this trust and transformation. One is the patients, the people. An example here I would like to give was 2 years ago with the Mpox outbreak, for example in Portugal, where they managed to contain the Mpox even before the vaccines, based on community empowerment. That's what we did at WHO Euro as well, with the predecessor of Pamela, the ECDC, with the directors of the Euro Pride. We quickly convened the press conference and focused on gay groups, bisexual, LGBT+, and told there should be no stigma and discrimination, but we have to involve them, and they did actually an amazing job, and the results were there. We involved and empowered trusted messengers in the community. This is crucial, number one. Number two, the health professionals. Health professionals, as many of you know, are under tremendous pressure. So as a WHO, we have to be there to advocate for them. As the minister was telling 2 weeks ago, I was in Ukraine to the front line. I mean, you cannot overestimate how important it is for the doctors, the nurses who have been there for 2-3 years to be there, even in dangerous circumstances, and to take care also of their mental health. Actually, this evening at 6 o'clock, I have the privilege to speak, to give the keynote lecture for the European Congress on emergency medicine. And that's key to continue engage with specialists and put them at the center of solutions. The patients and the professionals, they know what to do and to co-create. And the third one is the politicians. Very important. There I would like to thank the German Chancellor Scholz, who invited me tomorrow at the Berlin Balkan Summit, and we're the only UN agency present there, to advocate for health at the political agenda. But for this, we need to create and sharpen our narrative, not an old narrative. We just finished the Global Health Diplomacy Dialogue Edition 2 in Brussels, and for the first time we had a session with the External Action Service of the EU, with NATO, how health links to national security. Because we see that health importance is dropping in many, many countries and levels, but security is important. So if you talk to a prime minister or president, how a country can be secure if you don't have the stockpiling, if you don't train your workforce for the wounded, for the all hazards approach. So we have to be more smart here to link the health with the bigger agendas. And finally, I always talk about primary healthcare. During the COVID-19, when trust was low, the OECD reported that 78% of the population kept the trust in their primary healthcare providers. Proximity is very important for trust.
Excellent. Thank you so much. You bring up interesting concepts about the people-centered approach, looking at the high-risk groups, looking at the health workers, ensuring we build that trust at that level, but also interesting link to politics and national health security and the systems, back to systems. I'd like to turn to Dr. Pamela Randy Wagner, the director of the European Centers for Disease Prevention and Control. She brings extensive experience from her previous role as Austria's Minister of Health, the Director General for Public Health and Chief Medical Officer. And she has led significant efforts in pandemic preparedness, crisis management, and major health reforms during your tenure. Dr. Klug has shared relevant regional initiatives and learnings, building on this from the European CDC perspective. What steps have been taken to build trust at the regional level to strengthen emergency preparedness and response? And what do you see as the biggest challenges and opportunities in this area?
Well, thanks for the question and the warm welcome, and also good morning from my side. Well, I'm very grateful and thankful for this very important topic, trust. It's not always in the center, or hasn't been always in the center when it comes to preparedness and pandemics and management of outbreaks. But for me, if I have to summarize the major lessons learned from the last pandemic, it's the 3 big T's. It's about more timeliness, more teamwork, cooperation, and more trust. So I think trust is of utmost importance, as Karl Lauterbach has already pointed out. I think it doesn't need only a vaccine for science or a science vaccination for politicians. I pledge more for a combination vaccine of science and trust vaccination for the politicians as such. But with regard to the European Centre for Disease Prevention and Control, we have to say the number of stakeholders when it comes to trust and collaboration is a high number. So the numbers of corporations is quite high. It's a cooperation with the member states, which is 27 at the number. And it's also the new accession countries. So we also work with the Ukraine very intensively already. It's the cooperation with the political level, of course, at the European as well as at the member states level. It's the cooperation with the scientific field, such as Robert Koch Institute here in Berlin, where we have very strong relationship at the technical level. And most importantly, also the collaboration and cooperation with the broad public. And all of these cooperations are very specific. And they have their specific challenges, of course. And for me personally, the most interesting one is the one with the political level and the broad public as such. Well, having this in mind, I have to say there's one thing which is true for all kinds of collaborations we're facing. Collaborations, if we want to strengthen future preparedness for future health threats, needs always to be open, transparent, and continuous. It needs a continuous activity, collaboration, and communication between the partners, also at the international level, with our international friends at WHO, for example. It's too late, and it's not enough to ask for trust when you need it most during the crisis. So the time to build up trust is before the crisis, is before the pandemic, it's before the outbreak. It's not in. Because during an outbreak and within a crisis, the pressure, the time pressure is extremely high on the politicians, on the scientists. And if you have high time pressure to decide, you need even more trust. So it's not the right time to start building up trust. But if we manage this jointly together at the right way to do, to have a coordinated way and a really timely and quick response in emergency situation, we also gain jointly the trust of the population. Speak with one voice, quickly, give answers together, evidence-based, science-based. To be very concretely, in the case of ECDC, how do we do? Well, we have just started a few months ago a very intensive collaboration directly with the member states. This hasn't been the case before the pandemic. So the ECDC's new mandate is to work directly within country visits. So far, we have done 3 country visits in Belgium, Finland, and Estonia, where we spent, it's a team of 10 experts of European Centre for Disease Control, spending about a week's time intensively working with the national level, with the experts, in questions of preparedness, surveillance, trust, response. These are the important questions. They sit together whole day, 7 days. And so far, the feedback from the member states and my experts was, this is an extremely trust-building activity, because they sit together. So having in mind that we have a common goal to respond more effectively and more timely in the next pandemic, in the next health emergency, we have to have in mind the objective is not just an abstract one. It's not a question who is right or wrong. It's not a scientific competition. I'm a scientist originally by profession. I'm a doctor, but it's not. A health emergency is not a competition, a scientific competition. It's only about saving lives. That's the goal and the common objective.
Excellent. You bring in very important concepts of openness, transparency, and the continuity of building trust, and how we need to work on trust before emergencies strike, and finally that it's not a competition. We are here to save lives. Thank you so much. I'll now pass the floor to Dr. Hanan Balki, the WHO Regional Director for the Eastern Mediterranean region. She is recognized for her global leadership in antimicrobial resistance and infectious disease prevention. As the WHO Regional Director for the Eastern Mediterranean, she plays a pivotal role in advancing public health initiatives and strengthening health systems in her region. Thank you so much for joining us. And just to get your perspective, recognizing that trust is key to effective collaboration, what steps has WHO EMRO taken to build trust in your unique setting? And please touch also as well on some of the biggest challenges and opportunities that you have.
Thank you very much. I hope you can hear me. I understand there's a video challenge between Doha. I'm here ahead of the Regional Committee 71. I wished I was with you, but I've been listening from the beginning and very inspired by by the previous speakers. As you said, of course, this is a very difficult region. We have 16 large-scale emergencies, including 8 complex humanitarian crises. And of course, we're also responding to 69 outbreaks affecting 21 of our 22 member states. Some of our countries are experiencing 3 to 10 different outbreaks, let alone what's happening in Gaza, which I can speak a little bit about with the resurgence after 25 years of polio. In building trust, it's extremely critical. And I think without trust and being trustworthy, as Mike was saying, we will not be able to be efficient in executing what we would like to do for the people on the ground. And part of that first steps is communication. So I would like to emphasize that in the Eastern Mediterranean region, our presence through our country offices and the regional office, and of course, the headquarters support, we have presence in all of our countries, and specifically the ones with the emergencies and the humanitarian crises. Our presence is pivotal and is extremely operational in case anyone would have doubts about the operationability of the World Health Organization. We're standing side by side with not only the ministries of health, but with the whole of government in also leading the health clusters within each of our country offices. And that commitment on the ground is extremely critical in building and sustaining the trust that is needed for us to move forward. The second thing that I wanted to mention is that we are engaging in joint accountability with our member states and in being very transparent on what we can do and what we cannot do in order to make sure that there is clarity in the mandates and the ability to serve and where we can serve. And that allows us also to be very transparent on what our opinions are in some of the countries that are facing certain challenges in specifically when we talk about IHR, when we talk about reporting diseases. I would wish one day that disease and health will not be something that's a stigma or that we're shamed about. Regardless of anything that's happening in any country, diseases should not be something that we should be shamed about, even if we're talking about an outbreak of any of the communicable diseases. So that shared accountability and ensuring transparency from our side will hopefully and enhance the countries and encourage them also to be transparent. That type of transparency on reporting of diseases becomes extremely important to serve the member states to start with, then the region, and of course, globally. I would also like to emphasize the importance of that EMRO region works on in health dialogues. In developing trust, we need to show and emphasize to our member states that it is their people that we are worried about and concerned about. It is the people of the member states that we would like to serve first and foremost. And after that, comes the regional mandate and the global mandate. And in some of the member states that are within my region, we are dealing with de facto governments or with several, complex political situations on the ground. And we need to gain the trust of all of those partners and all of those entities to make sure that we can continue to deliver. We are doing health dialogues to build trust between countries within the member states, not only between WHO and the member state, but the multilateral engagement that we're doing between the member states to sponsor, to support, to host, to further advance collaborations on access to healthcare, to commodities is extremely important and needed in our region. We're also building trust by showing that we do not just focus on bending curves on certain diseases or enhancing access, but we need to build that leverage of economy and healthcare. And if we can support our member states and show them that we have that intellectual capacity and engagement capacity to enhance your economical standpoint at the country level to become more and more independent from international organizations, then that's very important. I'm sure I will not put myself out of a job or my colleagues, but this is extremely important to build trust that we want them to stand on their own feet. Last but not least is an issue that I want to bring. Trust was mentioned today, and it is the theme of this extremely important session. However, in my region, what my member states are also asking, they would like to trust the global community. And I want to commend Professor Carl on his amazing intervention. And it is true, the points that you have spoken about, I have written them down. And it is true that for us to finalize the pandemic agreement, we need the low-mid-income countries and the countries under sanctions and under hardship to be able to trust the global community that they will be supported and that health is not connected to a political agenda. So I think that this is going to be very important. This is not an easy region to manage. However, I'm extremely honored and privileged to be able to serve the people of the Eastern Mediterranean region. I ran out of my 5 minutes, so I'm not sure that you want me to keep going on with challenges. So I'll stop here and I'll allow you to offer me another slot. And over to you. Thank you.
Yes, thank you so much, Dr. Hannan, and we will come back to you for sure. Thank you for bringing an important dimension about building trust between member states. That's very critical in your region, and how you are also linking the advocacy around economy and health care. And we'll also come back to the concept around trust at a global level and how we need to build that trust as a global community. Thank you so much. I will turn to Dr. Lisa Indha, who is the Executive Director ad interim of the Caribbean Public Health Agency. A very unique context in the Caribbean, and you have vast experience in regional and international public health around surveillance and response to enhance regional standards and public health policies. We'd like you to share your thoughts from the Caribbean perspective on how your agency is working to strengthen and build trust.
Thank you very much, and thank you for asking us to be part of this important panel, and greetings from the warm Caribbean. But let me start by saying, you know, as all the speakers who said before, and all of what they have said would apply, I mean, trust is something that is built, and it's something that is earned. And when we come to the Caribbean, the first thing you have to think about is context. So, you know, we serve 26 countries, Caribbean countries, but they're diverse and they're sovereign states. And they range from as small as 5,000 persons to about 11 million, but they're still sovereign states. And they vary in terms of capacity. Some countries are unable to even test for one pathogen, whereas we are trying to tell them to do PCR, you know, in terms of surveillance and response. They have under-resourced in terms of human capacity, under-resourced in terms of finance. And when you put that in the context that we're the most tourism-dependent region, so, and our borders are very porous and interconnected, so most of our cases of new illness, the first case of SARS and COVID and all this variant came in through a traveler, but we are tourism-dependent. Put that into context with the fact too that, you know, we are vulnerable to natural disasters, to climate change. you really are dealing with a complex situation. So anytime you're thinking about looking at health emergencies and building trust, you have to look at this context, and then look at the context of that you then require building trust at the local, national, as well as the international region, because most of the different agencies, WHO, PAHO, CDC, UK, and so on, also invests in the Caribbean. So for us, the biggest thing in building trust is going back to the people and looking at their specific nature and developing Caribbean or specific interventions. So one shoe doesn't fit all in the Caribbean. You have to look at what are the specific needs of the region, and you also have to understand an outbreak in one country or one member state, it's an outbreak in the Caribbean because of our interconnectedness. So getting them to understand and getting our countries to trust us using the science, to trust us to come up with the whole issue of the whole concept of regional coordination and collaboration. And that has been huge for us, because anything we do in the region, we need to have all our member states, coordinating and harmonizing in terms of intervention if we want to protect the region. And a good example of that was COVID-19. Because CARFO worked directly with our countries, directly with our different agencies, national and international, we were able to come up with different methods of coordination and harmonization. So June 2020, all our countries actually closed their borders, and that's because they trusted the science and they trusted CARFO for coordination, and that resulted in blunting our curve. While other countries, other regions had steep curves, our curve was blunted in the region. And there are many, many examples, and I can go on and on. I'm seeing my 1 minute up, but part of it is really working with countries. They spoke of being country specific. When we do anything, we first work with our countries. We find out what their needs are. We develop tailor or country-specific activities. They're part of our action plans. And we invite the countries as well as the agencies to work. So we would have had a regional coordinating mechanism for health security and a regional health security pathway, which we develop with countries and all our regional and international agencies to really look at health emergencies from a health security point of view and to work in a harmonized manner.
Good. Thank you so much, Dr. Inha. Another very unique setting, and really the importance of tailoring this to the people, to the needs in the region, and the interconnectedness, working together as a block. I think that's a very interesting example. I'll turn to Dr. Raji Tajuddin, the Deputy Director General ad interim of the Africa Centers for Disease Control and Prevention, who's here representing Dr. Jean Kaseya, who could not join us in person, but really happy to have you, Dr. Tajuddin. He has extensive experience in health systems management, in child health and in public health leadership, and is actually coordinating the establishment of 55 national public health institutes across the continent, and also coordinating the 5 African Union member states regional collaborating centers. So we are happy that you could join us, Dr. Tajuddin. So again, reflecting on our agencies and how we build trust. I think at the continental level, we'd like your insights about how Africa CDC is working to do that, and so any particular challenges that are being faced on the continent.
Thank you. And let me start from this side to thank the pandemic for inviting Africa CDC to be part of this discussion. I bring you greetings from Dr. Jean Kaseya, who would have actually loved to be part of this discussion, but at the last minute, because of the ongoing multiple outbreaks on the continent, he couldn't be here. So when I was coming this morning, I saw the first room there. I saw Africa. Then this way I saw Europe. Then I look at the topic of discussion is around trust. You know, so I said, no, that discussion should have taken place in the Africa office and not in Europe office. But having said that, Your Excellencies, distinguished colleagues, ladies and gentlemen, one of the causes or the cause of the prolongation of the COVID-19 pandemic was the fact that there was complete erosion of trust capital. And you cannot talk about trust without talking about equity. You know, so if you look at this, then you understand where Africa is coming from. 8 years ago, our head of state, our executive council, the foreign affairs ministers, under the leadership of Dr. Tedros, decided to set up the Africa Centers for Disease Control and Prevention. Fast forward, our head of state and government felt that there's a need for us to begin to look at that space, that global health space, you know, with what we call the need for a new public health order, which essentially to really make sure that there's issue of trust and also to address equity. And the first and foremost on the list is to support our member states to build their institutions. You know, talking of the National Public Health Institute, talking of the Centers for Disease Control and Prevention, talking of the reference labs and so on and so forth. Number two there is to support the workforce, the public health workforce. Because today, if you look at the continent of Africa, you will discover that we are nowhere near where we are supposed to be in terms of the workforce. For instance, if you look at the field epidemiology training program at the advanced level, we talk of ratio 1 to 200,000. You know, today in Africa, we are far from that. Because for a population of 1.4 billion people, you are talking of roughly 7,000 epidemiologists. What do we have on the continent today? We're talking of around 1,800. You know, so to really address some of the recurrent outbreaks on the continent, we need to support workforce. A lot of things have been said around bringing the community on board. One area that Africa CDC is paying a lot of attention is to support the community health system, you know, through building the community health workforce at that particular level. And our head of state and government have added their voice to that, you know, to ensure that for every 500 people you have on the continent of Africa, there are at least one community health worker to support the 500 people. Number three is around building local manufacturing capacity for air security commodities. Today, we saw it in HIV/AIDS, we saw it with the COVID-19 pandemic, we are seeing it again with mpox, whereby a continent of 1.4 billion people is left to be at the end of the queue or to wait until when everybody has gotten their own fair share before we are considered. And President Paul Kagame said, you cannot guarantee your air security through goodwill. So you need to proactively begin to build your own local manufacturing capacity. So this explains why that local manufacturing capacity is actually second independent for the continent of Africa, as articulated by Dr. Jean Cassel. Number four is around domestic resource mobilization. Again, whether we like it or not, we also need to play our own part, you know, as far as building our air security, you know, on the continent. You know, and the enormous resources, I think it's just for us to find a way to optimize whatever resource that's available on our continent. Number four or number five is around respected, action-oriented, and trusted partnership. You know, we want partnership that will put the priority of our member state at the forefront, and not priority that is set from elsewhere. We have talked about this over and over again, so this is also an opportunity to re-emphasize that. The need for trusted, respected, action-oriented partnership, and also the need to implement Lusaka agenda. And I hope that we also have another 5 minutes to, you know, to elaborate more on some of this agenda. And last but not the least, whether we like it or not, the issue of public health has also become a political discourse. And this is where we come in as a specialized technical agency that sits within an intergovernmental organization called the African Union. So we're able to leverage at the highest political level on the continent. In fact, the Committee of Head of State and Government is part of the Africa CDC governance structure. So really, we are proud to be part of this discussion, and we look forward to implementing the outcome of this discussion, and not just another report on the shelf. Thank you.
Thank you very much, Dr. Tajuddin. There's so much to unpack here on this topic, and I don't know if the organizers will allow us, but you bring in a very good aspect around the political leveraging, working closely with the African Union and how we build trust through those structures with member states, but also highlighting important aspects around the workforce, around local capacities and building capacities in the member states for better health security. Thank you so much. So many common perspectives coming through, but also unique contexts that our panelists have brought forward. I want to go back to an issue that was highlighted earlier around the connectedness, the global connectedness of what we are doing. And to bring in, Professor Lauterbach did mention this, and also a number of speakers brought about the need for trust as a global community. And we appreciate that we all work within our sort of administrative or geopolitically defined areas of operation, but also appreciate that the concept of a cohesive region is sometimes not very practical when it comes to emergencies. These emergencies transcend borders, they transcend continents, and it requires a collaboration as a global community. So just within the limited time we have, one or two thoughts around how your organization or agencies are trying to maintain this balance between meeting individual country needs, but at the same time also working towards strengthening global collaboration when it comes to emergency preparedness and response. We'll start with Hans, please.
Thank you, Fiona. The example I would like to give came out of the COVID-19 is the establishment of the Pan-European Network of Disease Control. We have the ECDC, which we have a very good collaboration, but of course we have 53 member states, and there was no platform to discuss in a safe environment masks, no masks, closing borders, not closing the borders. So this came out actually of the Monti report that we had commissioned. As of today, it has 30 public health institutions of 18 countries. Countries are not obliged, it's iterative, but more and more countries want to be part. And it's important that the countries themselves are setting the agenda or identifying the issues. And there are 4 topics identified. To mention one is collaborative surveillance, which is so the Pan-European network, but together with the European institutions, very important, ECDC, but also the Eurasia Economic Commission, which is the eastern part of the region, the WHO Burden Hub, and thank you so much, Chikwe, for a very, very strong support. We have actually a staff member here at the hub for this. So it's a good connection between the country, the region, and globally on a specific issue, and that's very important, that it has to be very, very concrete where everyone sees the benefit. I have to agree with Professor Lauterbach that in which world we are living, it's very tense. But it also means that soft power becomes very important. You cannot, even if a country has a legalistic obligation, if the country doesn't want to have a certain government, they're not going to do it. Yeah. But soft power, based on the trust and the conversation and having a safe environment where you can share the issues and also failures, becomes very, very important. Thank you.
Good. Thank you so much. I'll turn to Dr. Wagner for an example from where you sit about how we are balancing this global as well as country-specific context. Yeah.
Well, I'm convinced this connection between the global level, on the one side, international one, and the European regional level, this is vital to be successful, to be coordinated, to have the knowledge and exchange of expertise. So since the COVID-19 pandemic, the so-called Health Security Committee, which was pre-pandemic only there if there was a health crisis as a communication room between the member states, the WHO, and the Commission, has now been established as a continuous, steady room of exchange and cooperation. On a really very regular basis, we exchange with WHO Euro, with the member states on all kinds of health issues, first of all. And ECDC, secondly, has strengthened the quantity, but also the quality of cooperation with the member states, but also at the global level. Through, and just to give you one example, by the introduction of a so-called EU Health Task Force. This is very new. It's a health task force consisting of ECDC experts, which are hands-on, on the ground, in the member states, if there is a health emergency locally or cross-border, to support if the member states want, but also outside Europe. And this I want to mention because we are in close collaboration also with Africa CDC when it comes to the outbreak control and support for the Mpox outbreak in DRC. So ECDC is on the ground with an EU Health Task Force of ECDC experts, epidemiologists, at the moment in Kinshasa. And there are two good reasons to do this. First of all, we want to support you and the public health authorities who are affected at the African continent, but also Africa CDC, to control this outbreak, which is enormous. And second, and this is important, we learn. It's not that just we support, we learn by working there on the ground. My experts learn every day, closing knowledge gaps about the epidemiology of this new clade, of this new virus clade of Mpox 1b. So I think this is a two-way street. It's a win-win situation. And this is what collaboration and cooperation is about. It's win-win. It's a two-way street. It's not just giving and receiving. It's both, always at the same time. We are all winners if we do it right.
Excellent. Thank you very much for those concrete examples and for your support as well to the region in this Mpox outbreak. We'll go to Dr. Balki. We promise to come back to you. Please, your thoughts around this global collaboration and trust building.
Thank you very much. And maybe I'll focus on three areas. I think this we try three areas. Number one is that we make sure that there's a tailored support. We need to recognize that each country has its own specific context. And we've done great examples on that, as you can see, in Sudan, in Gaza, in Yemen, in Afghanistan, and so on. But in doing that also, we make sure that we do our intra-operational reviews or intra-response reviews and cycles of improvement, self-reflection based on our own observations and external reviews are extremely important. The second aspect of moving forward with this is applying the best practices. We're applying the emergency response framework. We're providing input on its upcoming versions, and that becomes very important in building the trust and the predictability of how we respond to emergencies. Of course, it doesn't make it easy for us when we have escalating emergencies and crises in the region. However, the three levels of the organization meet on a regular basis, and we identify the level of emergencies and crises in each of the countries, and we come up with the plan together, and that allows for transparency, predictability, and also for the critical need for surge capacity when needed. So this is very important, and it's referred in our language, the incident management system, and it's based on our ERF, which you can find on our websites. The third aspect that I want to focus on in building the country context to the global contracts is the harmonizing regional and global coordination through the WHO's Health Emergency Preparedness, Response and Resilience, known as the HEPR framework. This becomes extremely important. And the last thing that comes along this again, and I don't need to repeat it, is the intergovernmental negotiating body outcomes, and that will indeed help us especially for the outbreaks, of course, in making sure that there is a coordinated response that focuses on the needs of the countries and not only exploiting them in a way or using their data for specific benefits of specific countries, which will not build any trust. In fact, it will kill the trust. And I do agree with Mike that the next pandemic, if we do not work on this trust building capacity to the best of our ability, we're going to be working in a much, much difficult situation. However, it's not just about outbreaks, but it's also about the emergencies and the crisis. And with that, I want to just inject one other vaccine to the global political arena, which is peace. Carl spoke about science and how critical it is, and I would like to add from this region that we need to do everything we can to ensure that peace prevails so that there can be better trust in building back our communities and serving the people that have now been suffering way too long. Thank you very much, and over to you.
Thank you so much, Dr. Hanan. And we are really pressed for time, so we are going to just try and start winding on final thoughts. I just want our panelists to give us, in just 30 seconds, one specific suggestion that you would make on something we need to start doing or do better as we try to build trust for better decision-making for health emergencies. In just 30 seconds, that one suggestion that you would put forward. We'll start with Dr. Tajuddin.
No. Thank you. Yeah. So just to really, compliment what Dr. Anna has said, I think we need to finalize this global governance, of this emergency preparedness and response. That's the pandemic treaty, and within that space, we also need to recognize, the complementarity of the regional mechanisms. Thank you.
Great. Thank you. Yes, Dr. Inha?
Yes, so 30 seconds. I would have two words, coordination and communication, and at all levels. From where we sit in the Caribbean, we appear to be small, but we need to work with just not our countries, but our international bodies in terms of developing that specific intervention that is going to work, and that communication and the coordination, meaning how do you share information in a timely manner? How do you work together to better fit to develop actions and activities specific for the region? So that would be, biggest for us.
Okay, great. Yes, Pamela?
Well, in addition what has been said already, more coordination, more cooperation, I think we need to engage more with the public, with the people. And then it's about communication and language. We have to speak the language of the people, not science. Scientific language is nice for me or for doctors and scientists, but for people who don't understand what we recommend if we use the wrong language, it's scary. And scariness is the wrong thing, which we don't need scary people and scared people in crisis, because this is the ground for populists, because they speak a simple language. So we have to find the right language to reach the people, because trust is decisive for the effectiveness of all our recommendations.
Thank you. Dr. Klug, your parting thoughts?
There is an old Dutch saying, trust arrives on a turtle and leaves on a horse. And I think to build trust, the motto has to be, leave no country, leave no person behind.
Good. Interesting. And finally, Dr. Hanan, your parting thoughts?
Thank you so much. I think from my region, during this current situation that we're living in, my first and last word will always be peace. We need peace today so that we can continue to implement all the beautiful things that were mentioned today. So let's pray for peace. Let's advocate for peace.
Great. Thank you so much to all our panelists for this very insightful discussion on building trust for better decision-making for health emergencies. I believe these are rich perspectives from different regions, from different organizations, and it demonstrates the complexity, the importance as well as the urgency around building trust. And we've had many common themes across the regions: people-centered, transparency, communication, science, and coordination. And at the same time, we have also highlighted the huge potential of regional public organizations and institutions in mobilizing stakeholders across different levels to collectively build trust from the ground upwards. I trust our audience is enlightened and galvanized around this issue. It's been an absolute pleasure for me to moderate this session. I thank the organizers for entrusting me with this role. And I would like, before handing the chair to Dr. Chikwe for the last segment, to ask our audience to give a very big round of applause to our panel.
Thank you. Thank you very much. Thank you. So before you go, just indulge us a few extra minutes. So we heard from Hanan Balki, who's just taken over a few months ago as the regional director for the Eastern Mediterranean office of WHO. But we have in our presence too one of our regional directors who's just about to leave her tenure at serving as regional director. She came into office during a period many people in this room will remember, at the peak of the Ebola outbreak in West Africa, with a lot of uncertainty on the African continent on how that would evolve. And since then has really transformed one of our most important offices, one of our most important regional offices, and taken it through many years of further development and evolution, seen through the growth of a partner agency, the Africa CDC, through a pandemic, and now after serving the organization and the world so illustriously, is about to step down. So it's a real honor to invite my dear big sister, Dr. Chidi Moeti, to say a few words on trust.
Thank you. Okay.
Thank you so much, Chikwe. And I'd like to greet, first of all, our honored panelists. The Honorable Minister has just walked out, but say thank you very much for having shared your perspectives on this very, very important issue of trust. I'd like to say hello to all the participants who are in this session. As Mike said to me as I walked in, I didn't believe it to be such a big session, so I think it just highlights the importance of this theme. And I'm very honored to have been offered by Chikwe the opportunity to say a few words and share with you some perspectives as I'm transitioning out of my position in 100 days or so, I think. So it's a great honor and a deeply personal moment for me to be given the opportunity to say the last words at this important and very inspiring session on building trust in health emergencies. Especially, this is my last time I'll be attending this conference that I've been to several times as the regional director for Africa. And I hope I see, looking around the room, that we have been able to mobilize a significant African participation in this Berlin conference. So I'm very proud of that and really pleased to have both policymakers, scientists, experts, young students, as you are giving lots of energy to this forum. I agree that trust is so important. I couldn't agree more with everything that's been said. And just to share some personal reflections, say that trust has been the cornerstone of my career in public health. Whether it was in leading WHO's action on what we called the 3x5 initiative, at the peak of the HIV/AIDS pandemic in working to have access to treatment for people in Africa, or whether it was my work with UNAIDS, with UNICEF, in the Botswana Ministry of Health, when at a certain point in time we were the worst affected country as far as HIV is concerned. I have seen firsthand how trust between people and communities, and I really would like to reinforce what's been said about the importance of trust with people, with health workers, with experts, with governments, and with partners, can shape the success or failure of our efforts. So reflecting on the work that we did in WHO on improving access to HIV treatment as African people were dying in the millions, the world was grappling with this devastating situation, and the scale in Africa was staggering. But what made the difference was the trust that was built, I would say first and foremost, between people affected with HIV. Uniquely, it was between gay men in Western countries who were severely affected by HIV and lots of people in Africa, particularly women. And we know that women were severely affected. For some of us, this was a very unusual combination of partners, and it worked extremely well. It worked very well to empower the African people. And I recall how at every AIDS conference, we'd know that some of our African friends will not be there at the next conference because they will have died. And they had indeed died. But this solidarity in working together, and I can say that the solidarity in stopping the president of a very important country being able to speak without explaining how the country was supporting access to HIV treatment has been for me one of the biggest inspirations, showing that we can build trust across continents, across communities, and across groups that we would not expect to be able to work together. So that's been one of the biggest lessons and inspirations that I've seen. But we know as well that trust between communities and their governments, and I think that's already been alluded to, is extremely important. And we can build this, I think, in different ways. First of all, it's very much been emphasized that we need to be working on this in peacetime. It is in peacetime that will show people that we're investing in your health, we're building the institutions, we're building the capacities, starting from the community level. And here I would like to reinforce what was said about not only the people, but those workers who in our region, for example, are the furthest from sources of expertise, are the ones that work around the clock, are very often women, I'd like to say, because the people who are working at the community level very much are nurses in many of our countries. We need to build trust across all these levels, right up until we build the trust at leadership level. I think this experience taught me another thing, that trust is earned. I think it's already been said. It's not given. It's something that we have to show every day in our actions at the different levels, that we deserve the trust of the people, we deserve the trust of the stakeholders. It's a trust we established before a crisis hits, by showing that we care enough to be investing, to be consulting, to be providing information, to be creating platforms for different stakeholders to be together, however difficult that may be. And I think as WHO, as an organization, we're doing our best to be playing that role across different stakeholder groups in order to build the capacity for pandemic preparedness and trust. We saw how trust has been so severely tested by the pandemic. First of all, the issue of misinformation. People's mistrust in the statements that their political leaders have made, and the space that this gave for misinformation to spread to such a degree that people were rejecting the interventions that were extremely important for them. And I think it's already been said that the trust that needs to be built between countries at very different levels of development, with different capacities to develop some of the tools that we need, and accepting that we share a common fate as humans, whether we are in wealthy countries and whether we are in poor countries. And I'd just like to conclude by saying that we in Africa have built a very strong, trusting relationship with the political system, the politicians, the African Union, and with the Africa CDC. We did have to transition through a negotiation of this trust, but I'm very pleased that we have built it and we're working together, for example, with a joint plan in supporting the response to Mpox, and we work across that way in many of the disease outbreaks in supporting our countries in the region. It's very important as well that we have South-South collaboration, that countries that are similar in situations across continents exchange capacities, exchange experiences, so that we can really work together at the global level to address the needs of our communities. I will go back to the issue of gender equity and say that in health, as a development area, we really need to build this by demonstrating that equity is possible, because we know that the biggest group of workers in providing health is women. And we are working in the African region in a program I'm very proud to be able to leave to my male successor to build women leadership in WHO in Africa. If we do that, then I think we'll really have built that trust. And then finally, without being too long, just to conclude on the very important steps that are being undertaken now in negotiating, we hope with a growing sense of trust, a pandemic treaty between countries that are so diverse. In Africa, we say every day that we provide our biological material for these tools to be developed. We would like that to be part of the equation as decisions are being made about affordability, availability of these materials. And I hope that, again, we agree that we share a common fate across the world, and some of the errors, mistakes, lessons that we have learned in the COVID-19 pandemic and some of the arrangements that were made really will help us conclude on these negotiations, which I'm very sad are not concluded by the time I leave WHO, but I'll be able to be a freer activist from my African country in supporting that dialogue, I hope, in the next year or so. Thank you all very much.
Thank you.